Okay, excellent. So this particular session may not be a very highly attractive kind of session because we're just listing the high yield topics is what is the topic says. But in that particular session, I'll tell you what are the most important things that you have to learn in biochemistry before you go for your NEET PG exams. Remember, these are the topics which are must know topics for NEET PG and INI-CET exams. And why am I bringing this topic? Why am I doing the session here? Because on 28th of April, I'll be doing a 7 p.m. session. It's a marathon. You'll be having a marathon. What marathon is it? You will be having 100 MCQs. That is, it can include the previous year questions and the image-based questions and artificially made modified previous year questions, everything under one single roof. You should be able to learn a lot. That is, I'll be doing approximately 2 to 3 hours of session in a one single stretch, where with that particular session you can gain as much amount of confidence as possible and learn as much amount of information as possible to crack any question biochemistry. I did such a session for the last NEET PG exam and it was a huge success. Many students were able to at least answer 7 out of 15 questions, at least 7 out of 15 questions in the NEET exam, and I was very happy that it happened. So are you all ready? Shall we start? Before we start, do you have any questions? Please let me know if you have any questions. I'd like to answer your questions. Yes, do you have any questions? Please plan your questions. In the meanwhile, let me tell you a few notifications here. I am Dr. Meenakshi Sundaram A S, NEET PG educator, and I'm MBBS MD and gold medalist in MD exams and a lot of MBBS subjects. And I'm a high octane educator for biochemistry and microbiology for the past 11 years. And I've been successful in placing various students in the top medical institutions every single year. I can tell you very honestly that from 2010 to 2019, I have placed really the high yield statements in students in the top institutions like AIIMS, PJ Chandigarh and JIPMA or NIMANS in major medical colleges across the country, and I have quite an experience to tell you what are the different kinds of questions that you can expect in case of NEET PG exams. And I'm also a quiz master, so the session that I told you which I'll be conducting on 28th will be definitely useful for you. Please come back for that. And there are some plus subscriptions available. When you have a plus subscription, you'll have daily live classes, structured courses, live tests and quizzes, unlimited access, and all of these you can get for a Dr. ASM Live code. DR ASM Live code you can use for 10% discount, and you'll be having exclusive access to all my classes. And there's also an iconic subscription where there is a combination of Unacademy plus Prep Ladder. You can have special class features. They are interactive. You can have calls for the learners, raise a hand. You can directly talk to the teacher, and you can never miss a class because you'll have recorded sessions. Lecture notes are available and you can watch the classes anytime and anywhere. Now look at this part. This is an important announcement for all the free students. You can use DRASM or DRASM Live as a code to answer any of these test series. And please have a look at this. April 4, 5, 6, 7, 8 and 9. You can actually answer these tests and you can see how you fare in your preparation. And there is an All India mock test coming up on April 17, 2022. This can actually help you benchmark your performance with the All India rank prediction. There is also a rank prediction possibility here. So please use code DRASM or DRASM Live to unlock the free test series. You can actually see your ranks in the national level. And there is also an Academy Lite for NEET PG students. And there is MBBS Prof 1 launching auto daily practice papers, DPP. You can try practicing it on your own after the plus classes are over. And after every plus class, this is your amazing limited time offer. If you buy for 12 months, get 2 months. For 24 months, get 4 months. By 36 months and 6 months offer. And these are the toppers. And these are the batches coming up. I'll be doing FMGA High Yield Revision MCQ batch on Plus series. And I'll be a part of this particular Plus series. And there is a doubt clarification batch that can happen. Mine is on... Mine I think is on 16th and 17th, 4 p.m. to 5 p.m. I'll be doing it on 2 different days. I can solve all your doubts that you have in case of microbiology and biochemistry. And NEET PG 2022 High Yield Batch, this is the prices for the NEET PG subscription. Just have a look at it. Okay, so let's begin. Before we begin, let me tell you a few things. Can I tell you a few questions from the past? Before I tell you what are the important topics, can I tell you a few questions from the past? The recent, can we approach it that way? If you're online, can you please let me know? After I tell you the questions and then I tell you the trend, is it okay for you? Rather than directly talking about which topics and contents are important for the exam, can I tell you the previous year questions and then tell you where to focus on? Is it okay? Please respond if you're online. Okay, thank you very much, Zul. So look at this part. Let me give you one example of a question. See, one question was like this. They had asked you about, let me start in a particular fashion. There were 3 to 4 questions. This is the match. 3 to 4 questions from the topics of vitamins. So I can give you a very strong suggestion, strongly recommended to read vitamins properly. I repeat, I can repeat it n number of times. I'll never be bored. Please read vitamins. It is strongly recommended. First, you have to know what are the different kinds of vitamins and what are the other names of the vitamins. First, you know, we divide them into A, D, E and K, which are fat soluble, and we have B complex vitamins and that of C vitamins, which are water soluble. Now, remember, you will be having a lot of questions from any of these vitamins because they can become a part of your metabolic processes. First, focus on the B complex vitamin. B1 is thiamine and the active form is thiamine pyrophosphate. B2 is niacin, the active form is nicotinamide adenine dinucleotide. B2 is riboflavin and the active form is flavin adenine dinucleotide and flavin mononucleotide. B3 will be nicotinamide adenine dinucleotide, it is niacin. B5 will be pantothenic acid, which will be seen in the form of coenzyme A. Then we'll be having B6, which is pyridoxal phosphate, PLP. We have B9, which is folic acid. Now you will be forgetting one particular vitamin called as B6, which is biotin. This biotin mostly does the opposite function of pyridoxal phosphate. Sorry, B7. B7 will be doing the opposite function of pyridoxal phosphate. Pyridoxal phosphate helps in carboxylation or decarboxylation. It helps in decarboxylation, while biotin helps in carboxylation reaction. Then we have B12, which is cobalamin. Now, these are the most common areas where the questions in the last 3 years have been trending. I repeat once again, have a look at this particular topic. This is very, very, very important. What I'm telling you right now. Oh, thank you very much, Shreyasaya. I think I might be better. So thank you very much. So have a look at this. Let me tell you the questions raised from all these topics in the last 2 years. Just in the last 2 years. I'm not going far away for 10 years or 15 years. I'm just giving you the questions raised from these topics in the last 2 years. Why did they ask about thiamine pyrophosphate? There was a case of Wernicke-Korsakoff psychosis or syndrome in which there was a direct attraction towards that of thiamine pyrophosphate. They also had a clinical question based on beriberi. Beriberi can be wet beriberi, which is involving CVS, and dry beriberi involving CNS, and that was also attributed to thiamine pyrophosphate. They had a question which was based on unpolished rice. Unpolished rice and the husk of wheat and grains will be having thiamine pyrophosphate. Deficiency can cause these manifestations. And remember, what other questions were raised about thiamine pyrophosphate? The thiamine pyrophosphate is an important component of 3 important complexes called as pyruvate dehydrogenase complex, alpha ketoglutarate dehydrogenase complex, branched chain keto acid dehydrogenase complex. These 3 complexes are similar even though they are involved in different pathways. For example, pyruvate dehydrogenase is involved in the conversion of pyruvate to acetyl-CoA. So this is a part of linker pathway. This is a part of linker pathway. Why am I saying linker pathway? Because this is the link between that of glycolysis and that of TCA cycle. Alpha ketoglutarate dehydrogenase is a part of TCA cycle itself. Branched chain keto acid dehydrogenase is a property of branched chain amino acid metabolism. Now all these things, you understand, these 2 are involved in carbohydrate metabolism. This is involved in amino acid metabolism. Questions have been raised from this area. For example, there was a question about Maple syrup urine disease. Tell me, maple syrup urine disease can be because of what? What deficiency? Anybody? Maple syrup urine disease is because of what deficiency? See, dear students, whoever is online right now, you have given your trust to learn something which is very important for this. So this session will be maximum for 45 minutes. So within 45 minutes, I'll be telling you as much as possible, because this topic is not a very attractive topic. If there is something that is happening in the form of MCQs or when topic is being taught, people will come rushing to it. But here I'm just giving you a list of topics, right? I remember and I know many students put all their efforts into one particular area, but they may not be able to get the required kind of results. That is why I'm showing you this very clearly. This is an area where you will be able to score maximum amount of marks. That is why I'm running this session. This session's topic may not be very attractive, but what is the purpose of the session? To tell you what exactly is the area where you have to focus on. And one more thing is, I'm coming up to give you the notification that on 28th April, on huge demand, approximately some 70 to 80 students had actually messaged me and mailed me asking for a marathon series on MCQs. So I'll be doing a 100 MCQ marathon series on 28th April 7 p.m. So please be geared up for it. Now let me show you this part. I'm just showing you what are the areas you have to focus on. So branch in amino acid metabolism. Maple syrup urine disease is a defect in the branch in amino acid metabolism. So it can be a part of thiamine pyrophosphate deficiency also. But what is the confusion here? Remember, all these three complexes are similar. What is the similarity? Can anybody tell me what is the similarity here? Pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase, branch chain keto acid dehydrogenase. What is common to all these three important enzyme complexes? All these are of course capable of causing dehydrogenation, which is oxidation. Okay, dehydrogenation is removal of hydrogen, which is technically oxidation, but they are very unique because they also cause decarboxylation. Just now, like 2 minutes back, I told you which coenzyme is important for decarboxylation. Just 2 minutes back, I told you which coenzyme is important for decarboxylation. Anybody? Which coenzyme I spoke for decarboxylation? Excellent, Malini. It is pyridoxal phosphate. So generally decarboxylation is done by pyridoxal phosphate, but here this particular thiamine pyrophosphate is supporting decarboxylation, which is a part of the dehydrogenase complexes. Now let me tell you what are the other questions raised from this topic itself. The components of the PDH complex, alpha KGDH complex and branch chain keto acid complex. See, if this is pyruvate dehydrogenase complex, the complex contains the enzyme itself called as pyruvate dehydrogenase. Apart from that, you will be having dihydrolipoyl dehydrogenase and dihydrolipoyl transacetylase. These are the three enzymes present where PDH is unique for PDH complex. If it is alpha KGDH complex, then it will be the same number of enzymes, but instead of PDH, you will be having alpha KGDH plus this one and this one. In case of branched chain keto acid dehydrogenase, you'll be again having branched chain keto acid dehydrogenase enzyme. Along with that, you'll be having these two enzymes, but the coenzymes are the same. You have vitamin B1 in the form of thiamine pyrophosphate, you have vitamin B2 in the form of FAD, you have vitamin B3 in the form of NAD, you have vitamin B5 in the form of coenzyme A, and you also have one more enzyme, one more vitamin called as lipoic acid. Now this particular area, if TPP, FAD, NAD, CoA, lipoic acid, any of them is deficient, still you will be able to have the similar kind of properties. And remember all these things when you are trying to answer questions from vitamins. Why? Because vitamins, as you think, is not a chapter where you learn about the source of vitamins, then you learn about the clinical features of deficiency. No, you have to go through the molecular level of understanding what exactly these vitamins are capable of doing. Remember, all B complex vitamins can act as coenzymes for enzymes. Coenzymes can be organic compounds, cofactors can be inorganic compounds also. Coenzymes is the primary function of all the vitamins. That is why in our food, eating vegetables will be most important because they give you minerals and vitamins. Now these vitamins, if you go for A, D, E and K, this is an MCQ, except K, no other fat soluble vitamin can act as a coenzyme. That means vitamin K can act as a coenzyme. Now look at the questions here. Now the previous year question was about Yes, there was a question that said a patient is on maize diet and with diarrhea, dementia, dermatitis and death. All these things will speak about Casal's necklace, seen as a property of pellagra, and the deficiency will be niacin. These are very simple questions which even a first year student can answer. But you're not supposed to make a mistake if at all these words are not clear in your question paper. So remember, this is also a question to be raised. Then it asked you about the problem in case of eyes. Eye, the patient is having dryness. He has a gritty sensation as if something is rolling in the eye, and then he has corneal softening. Corneal softening. Cornea, you use the word cato, and softening you add malacia. So all these things will point towards one particular vitamin called as vitamin A. Now in vitamin A, what are the problems that we have to understand? Vitamin A can have three forms called as vitamins. The OH form called as alcohol, which is retinol, and the aldehyde form called as retinal, and you have the acid form called as retinoic acid. Now, the retinol and retinal, both of them can go for trans isomerization and they can act as a part of Wall's visual cycle. Wall's visual cycle, where they attack your retinal part, while retinoic acid is involved in the turnover of your epithelia, where the skin turnover does not happen, the patient will have toad skin. Now, there was a question based on this. Also, retinoic acid is important for the turnover of your cornea and conjunctiva, because of which white hot spots can be seen. Now remember, when they speak about vitamin A deficiency causing nyctalopia or night vision, you are focusing on the retinol and retinal part. But if you are seeing about the white hot spots property of vitamin A deficiency, then you're looking at the retinoic acid deficiency. This is where many students have made a mistake. Also remember, retinoic acid is one simple acid which is acting as a vitamin which has nuclear receptors. Now comes the question, which other hormones can have nuclear receptors? Anybody? Which other hormones have nuclear receptors? Yes, very good. Frenoderma Meenakrishnan. Yes, very good. Tell me, which other hormones can have nuclear receptors? This is where many students can make mistakes. Steroids do not have nuclear receptors. In fact, steroids are known to have cytoplasmic receptors. Cytoplasmic receptors. This was an MCQ as a combination of physiology and biochemistry. Okay, now tell me, what is the common structural property for all the cytoplasmic steroid receptors? Anybody? Very good, Ekta Tiwari. Yes, in case of nuclear receptors, thyroid hormones, thyroxine can have nuclear receptors. Vitamin A, retinoic acid can have nuclear receptors. Please remember, retinol and retinal are not concerned about receptor activity. So retinoic acid is the one that binds to the nuclear receptor. Thyroxine also acts on the nuclear receptor. Excellent point. But remember, steroids in general, glucocorticoids, mineralocorticoids are not supposed to have nuclear receptors. They have cytoplasmic receptors. Just tell me, in terms of structure, level of structure, what is unique for all the steroid receptors? What is unique for steroid receptors? Please note this down. Zinc finger motif is the one that is present on the cytoplasmic receptors which are meant for steroid ligands. So you can call them as steroid receptor superfamily. Steroid receptor superfamily. This all receptors who are similar in binding to the steroids will have one motif called as zinc finger motif. Now let me ask you another question. When I use the word motif, which level of structure of a protein that we are talking about? This is how the questions will expand. Remember, biochemistry, you don't start with one particular chapter and go through other chapters and see whether you'll be getting this many number of questions in each chapter. You start with one logic and you see how the logic is ramifying. the ramifications of a single topic into different areas where it penetrates into other topics, that is where your questions will lie. How did we start? We started with the vitamin A. Then we spoke about receptors of the vitamin A, retinoic acid. And that brings you to the concept of cytoplasmic receptors called as steroids. Now the receptors will have a common function and their property is zinc finger motif. Now if that is present, they are called as steroid receptor superfamily, right? What level of structure is it? Okay, now let me show you a different topic which is also important. Look at this. Alpha turn alpha, beta turn alpha, alpha loop alpha, alpha loop beta, beta barrel, Greek key motif, MOTIF, leucine zipper, Rosman fold, zinc finger. All these are called as which level of protein structure? Okay, just tell me, what are the levels of protein structure you think of? Come on people, just say something. How many levels of protein structures can you think of? Okay, Malini Krishnamurthy, we have primary structure, secondary structure, tertiary structure, quaternary structure. These are the straightforward structures you know. But there are some times where the secondary structures can go for folding among themselves. Folding among themselves. For example, secondary structure contains alpha helix and beta pleat. Now when alpha and beta pleats are having a folding among themselves, this is called as, excellent Kumar. It is super secondary structure. Super secondary structure. In that, the Greek key motif was asked twice. And leucine zipper was not asked in the recent 5 years, but zinc finger motif was asked. And I told you, zinc finger motif is the common property of all the steroid receptor superfamily. The ones which are capable of binding to the steroids. That is, a receptor is a protein. The protein has been folded into a super secondary structure called as zinc finger, which is capable of accepting a steroid. I repeat once again. You are looking at a steroid receptor, the receptor who binds to the steroid, which can pass across the membrane, diffuse across the membrane and enter into cytoplasm. If this receptor protein is what you're looking at, that receptor protein structure is in such a way, it can bind to the steroid. And what is this structure? A super secondary structure called as zinc finger motif. Now let me ask you a question. Then what is the beauty of a Rosman fold? Anybody? What is the beauty of a Rosman fold? Anybody? This was asked in the recent past, that's why I'm asking you this. These are the areas where you have to focus on MCQs. Rosman fold, yes, let me tell you. Rosman folds are important as DNA binding domains. They are known for having DNA binding domains. Shall I explain you how, if you're interested? No, Fariz Hussain, it is not quaternary structure, it is super secondary structure. Shall I explain you what is the meaning of DNA binding domains of Rosman fold? If you could respond quickly, I'll be able to answer faster. Yes, that is present in the auxiliary test property, but shall I explain you what the meaning of that is? Yes. Now listen carefully. You think of NAD dependent lactate dehydrogenase. Now as Meena Krishnan says, lactate dehydrogenase belongs to oxidoreductase class of enzymes. And that brings us to another topic. They can ask you about the class of enzymes. How many classes of enzymes you know, people? I'll come back to the slide. Just answer, how many classes of enzymes do we have? How many? How many classes of enzymes do we have? Yes, come on. Yes. Excellent. I can understand what you're saying. Very good, Dr. Ekta Tiwari. Nana NEET PG is not 5. Let me write you this. This is Oth Lil. This is the classical 6 classes of enzymes. O is oxidoreductase. T is transferase. H is hydrolase. L is lyase. I is isomerase. The next L is ligase. Now let me show you what are the common mistakes done by the students. If somebody comes and asks you hydroxylase belongs to which class? Students will easily say it belongs to hydrolase. No. Hydroxylase means if there is a compound called as XH, you are converting the compound into XOH. It means you have introduced a single O. Addition of oxygen or removal of oxygen, addition of hydrogen or removal of hydrogen, addition of electrons or removal of electrons, all of them come under oxidoreductase. So hydroxylase comes under class 1 called as oxidoreductase. Now the transfer of O and H groups. If you are transferring something other than O and H groups, for example sulfate, phosphate, ammonia, methyl group, carboxyl group, etc., it can come under transferase. Hydrolase means if there is an AB bond, you add water to break the bond, that is called as hydrolase. Lyase means the same AB bond can be broken without water. Isomerase example can be triose isomerase or triose phosphate isomerase, and ligase, it is trying to bind two things together. For example, acetyl CoA is present, it is ligated with the carbon dioxide to become malonyl CoA, so they can also act as synthase. These are the regularly known 6 classes: oxidoreductases, transferase, hydrolase, lyase, isomerase and ligase. The 7th class of enzymes would be translocases. Those enzymes who are also acting as transferring agents in the cells, they are referred to as translocase. Excellent, Ekta Tiwari. Okay, now come to this topic. NAD will be utilized in the lactate dehydrogenase activity. Now watch what exactly happens here. Imagine if this is the enzyme called as lactate dehydrogenase. It works both ways. What does it mean? For example, in anaerobic glycolysis, pyruvate becomes lactate. There also LDH will be acting. On the reversal pathway, lactate can become pyruvate in gluconeogenesis. There also lactate dehydrogenase happens. So the common name is lactate dehydrogenase, but it can convert pyruvate to lactate or lactate to pyruvate. Now, if pyruvate is coming as a substrate, then what leaves is called as a product. If the substrate is lactate, the product is pyruvate. Or if the substrate is pyruvate, the product is lactate. Now watch very carefully the formula for pyruvate. CH3, C double bond O, COOH. This is pyruvate, this is lactate. CH3, CHOH, COOH. Now, if I want to convert pyruvate to lactate, you have to add 2 hydrogen. Who can offer the 2 hydrogen? NADH plus H plus will become NAD plus. The same reaction, if lactate has to become pyruvate, then the 2 hydrogen will be taken up by the NAD plus to become NADH. Now remember, NAD plays a major role in the activity of lactate dehydrogenase. Now what exactly happens? NAD is nicotinamide adenine dinucleotide. Though they say the dinucleotide is a misnomer, you have nicotinic acid to which an amide bond is formed, then that is bound to a ribose sugar, that is bound to a ribose sugar, that is bound to an adenine residue. Now this is the whole structure of NAD. When you have adenine, it's a component of the DNA. For example, I write ATTGC. This A is technically AMP, which is made up of adenine plus ribose plus another phosphate. Now remember, these components are the components of DNA. So when NAD has to come and bind to an enzyme, NAD is a type of nucleic acid kind of situation. So if it has to bind to this enzyme, then there is a small space on the enzyme. That space which binds to NAD is a DNA binding domain, and that is made up of Rossmann fold. Did you understand this? Meena Krishnan, Ekta Tiwari, Nana, Malini Krishnan. Did you understand this explanation here? The enzyme is lactate dehydrogenase. It deals with lactate and pyruvate, of course, but it has to bind to NAD or NADH plus H plus. So the space that is present in the enzyme which can accommodate NAD is made up of Rosman fold. Did you understand this? Yes, I hope you'll be able to use them in your exams. These are the common questions raised from the enzymology. Now let me show you other topic questions also. Now there is one more topic where questions have been raised left and right, where pyridoxal phosphate is a very important coenzyme. Now let me tell you the most important biochemical reactions where PLP can come into play. Number one is transamination. For example, AST-ALT depend on PLP. Then trans-deamination, oxidative deamination, then decarboxylation. For example, if you have glutamate, glutamate is an alpha amino acid. If it is not properly decarboxylated, then GABA is not formed. Now this question was raised in INI-CET 2020 and it was repeated in 2021. Then it stopped. Glutamate is the source of GABA. Glutamate gets decarboxylated to become GABA. That requires pyridoxal phosphate. If there is no pyridoxal phosphate, decarboxylation stops, GABA is not formed. Because GABA is not available, which is an inhibitory neurotransmitter, then there is sustained contractile state happens. Because of less amount of inhibitory neurotransmitter, it can cause seizures. So infantile seizures can happen in case of PLP deficiency in a newborn. This was an important case-based question raised and that relates to PLP. Next you have, apart from the transamination and decarboxylation, glycogen phosphorylase depends on PLP for its function. Phosphorylase. And what is this glycogen phosphorylase, a rate limiting enzyme of anybody? Glycogen phosphorylase is the rate limiting enzyme of what? Come on, people. Excellent, Malik Krishnamurthy. It is glycogenolysis. So when PLP is not available in abundance, then glycogen breakdown to become glucose will not be optimum, because of which when a patient is actually fasting, he may go in for hypoglycemia, and that can be because of the PLP deficiency. This is how PLP can be related. Then PLP is also important as an ALA synthase supporter. ALA synthase is the enzyme that catalyzes the first step of heme synthesis, where succinyl-CoA plus glycine will form delta amino levulinic acid as the first step, and that coenzyme is pyridoxal phosphate. If pyridoxal phosphate is deficient, the patient can have anemia. That is PLP deficient anemia. Can you name one more function of PLP, anybody? Yes, very good. Can you name one more function of PLP, anyone? Okay, let me finish this for you. It can help in transsulfuration reaction. I'm giving you a clue. It is important for transsulfuration reaction. Can anybody tell me where this transsulfuration reaction comes into picture? Where have you learnt about the transsulfuration reaction coming into picture? Where do you come across the transsulfuration reaction coming into picture? Let me tell you this. There is a very special reaction where homocysteine will react with serine in the presence of an enzyme called as cystathionin beta synthase, which can produce something called as cystathionin, and that will be broken down in the presence of cystathionin gamma lyase enzyme to become cysteine plus homoserine. Now in these two reactions, PLP is important. Why is it called as transsulfuration reaction? See, homocysteine is the one who contains the sulfur here. Now this sulfur is moving into the serines area where it becomes a part of cystathionin and gets retained back as cysteine, while homoserine is coming out from homocysteine. So here transsulfuration reaction happens, for which PLP is important. Now imagine if PLP is deficient and then cystathionine beta synthase will not be able to happen, cystathionine will not be formed, homocysteine levels can be elevated. This can also be a reason for hyperhomocystinemia. Or if the cystathionine beta synthase is effectively functioning, but cystathionine gamma lyase is not functioning, then cystathionine can involve. That is called as cystathioniniuria. Now these are the areas where questions have been asked left and right. So remember, this is the area where questions have been asked. Yes, excellent. Ekta Tiwari, from your topic also, from whatever you said, listen very carefully. You have the active form of an amino acid called as methionine, which is called as S-adenosyl methionine. Only when the methionine is adenosylated, it can offer the methyl group to someone else. Let me call it as SAM. If SAM is present, it can give out the methyl group in such a way it can become SAH, homocysteine, S-adenosyl homocysteine. Now that methyl group can be taken up by the B12 to become methylated form of B12. Now that methyl group can be given to folic acid to become methylated form of folic acid. Now these are the areas where you have to understand a methyl group, or one carbon compound called as methyl group, has three important carriers. One is methionine, the other one is B12, the third one is folic acid. But folic acid is very essential because it's an important one carbon carrier. Why is this relevant? Why is this relevant? Because there are different forms of one carbon, that is methyl, methylene, methinyl, formyl, formimino, hydroxymethyl, and so on. Now there are different forms of a one carbon group, out of which methyl group alone is transferred by B12 and methionine also, while folic acid can carry any of them. Now if the B12 is not available to take the methyl group from the methyl folic acid, then the folic acid is stuck with methyl group in such a way that none of the other one carbon can be carried by folic acid. Let me repeat this again for you. I'm saying methyl group is only one type of one carbon pool. This methyl group can be carried by B12. It can be carried by folic acid. It can be carried by the amino acid called as methionine. But if the B12 is not taking the methyl group from the folic acid, then folic acid is stuck with the methyl group. At that point of time, the folic acid is not available for transporting any of these carriers. That is referred to as folate trap. So remember, B12 deficiency can cause folate trap. Excellent, Niharika. So this is an area for important MCQs. Now comes another question. B12. What is the active form of B12? You have cobalamin as the basic name. The cobalamin, if it is bound to. Now let me show you a structure. Can you identify the similarity of the structure with someone else? Tell me, this structure resembles which other structure? Excellent, Ekta Tiwari. This structure resembles which other structure? Whatever I have drawn here, this is cobalt. This structure resembles who other structure? Which other structure? Excellent, very good, Nana. It is not hemoglobin. Yeah, it can be hemoglobin or heme. So how do you draw the heme structure? When you have pyrrole, there is photoporphyrin here, you have iron here, you have the globin here. On top, you will be able to have binding with that of oxygen. When oxygen binds to iron, what do you call it as? Do you call it as oxidation? When oxygen binds to iron, do you call it as oxidation? When oxygen binds to iron, do you call it as oxidation? You don't call it as oxidation, you call it as oxygenation, because it is mere binding of oxygen, no chemical reaction. When will you call it as oxidation? If the Fe2 plus has been converted into Fe3 plus, then that is called as oxidation, which converts the hemoglobin into methemoglobin. Excellent, Niharika. Now look at this. Cobalt also has a similar property where 4 of its bonds have been bound to the ring area. 1 is bound to the protein. Now this is free to bind to many things. If it is bound to methyl group, it's called as methylcobalamin. If it is bound to cyanide, it is called as cyanocobalamin. If it is bound to water, it is called as aquacobalamin. If it is bound to OH, it is called as hydroxycobalamin. And can you name one more binding area? Methylcobalamin, cyanocobalamin, aquacobalamin, hydroxycobalamin. One more. Come on people, just one more. The one that can bind to the cobalamin part. Yes, anybody else? Excellent, it is adenosyl. Now, this has become a hotshot question. Why? How? Remember, whenever they speak about transmethylation reactions, you will be concerned about B12 in the form of methyl B12. Many transmethylation reactions can require methyl B12. For example, you will be able to have S-adenosyl methionine being helpful for converting guaninidoacetate into a compound called as creatine, where indirectly the methyl B12 can come and support S-adenosyl methionine. Also, methyl B12 is important for methylation of sphingomyelin areas, because of which sphingomyelin synthesis can be helpful, because of which neuronal growth and neuronal insulation can be present. And that is why whenever somebody has abnormal sensations of paresthesias, they give you B12 injections in the form of B12, methyl B12 or cyano B12. But if you speak about adenosyl B12, that chemical reaction is completely different. It is not transmethylation reaction. What kind of things can you see in case of adenosyl B12? Ado B12 is helpful in what reactions? Anybody? That was asked in the INI-CET 2021 exam and in the NEET 2020 exam, that is January 2020, almost 2 years back. Yes, Ado B12 was asked twice. That is why this is a high yield area. Come on, Ado B12 is for what function? Methyl B12 is for transmethylation reaction. But Ado B12 is for what function? I repeat here, listen very carefully. When you have propionyl CoA made to enter into the TCA cycle, it finds a small opening in the TCA cycle in the form of succinyl CoA. So you are trying to convert propionyl CoA, a 3-carbon CoA, into a 4-carbon CoA called a succinyl CoA. And that is capable of entering a TCA cycle that makes propionyl CoA as a glucogenic precursor. Now tell me, what are the sources of propionyl CoA? I repeat here, branched chain amino acid metabolism can give you propionyl CoA, and odd chain fatty acid breakdown can give you propionyl CoA. See, if it's an even chain fatty acid breakdown, you keep on removing 2 of them, 2 carbons at a time. 2 carbons can be removed as acetyl CoA. But if it's an even chain, all of them can be broken into 2. They can be multiples of 2. But if it is if it's an odd chain, then you can break down all the multiples of 2. At the end, you'll be retained with 3-carbon fatty acid, and that will be a propionyl CoA. So branched chain amino acid breakdown or odd chain fatty acid breakdown can give you a propionyl CoA. That will be getting a carbon dioxide to become methyl malonyl CoA. That methyl malonyl CoA will be initially D-methyl malonyl CoA. Because of mutation, it can become L-methyl malonyl CoA, and that on rearrangement can become succinyl CoA. In that area, Ado B12 is a must. This was a question raised in the past. I hope it was helpful. Did you understand this, people? This is a high yield area. Did you understand this? Yes, very good, Ekta Tiwari, Malini Krishnamurthy, Niharika, Nana NEET PG, very good. Is my speed okay for you? Do you want me to go slow? The class will be for another just 10 to 15 minutes. Do you want me to go slower? Is the speed okay for you? Yes, very good. It's an isomerase. Okay, so another 15 minutes. Let me wind out the remaining 15 minutes. Look at this. Now, in case of carbohydrates metabolism, 10 years back, they had questions focused on the types of isomerism you see in carbohydrates, which were functional isomerism between glucose and fructose, where one is aldohexose, the other one is ketohexose. Then they had anomerism, which was based on the anomeric carbon. What is anomeric carbon, anybody? The carbon on the Haworth projection. When you try to draw a hexose, you have Haworth projection where there is a hexagonal ring structure being formed. In that, if the C1 is actually the presence of an aldose sugar like glucose or mannose or galactose, the C1 sugar contains aldehyde group, which is carbonyl carbon. But if it is fructose, you can find them in the furan form, where C1 is not the anomeric carbon, C2 that contains the keto group is the anomeric carbon. So anomerism is based on the carbonyl carbon. The carbonyl carbon means either the ketone or the aldehyde. In case of aldohexoses, the aldose, the first carbon is the carbonyl carbon. In case of keto sugar like fructose, the second carbon, the keto carbon, is the anomeric carbon. So functional isomerism, anomerism, that is, anomerism is the reason behind mutation. Then you can have epimerism, optical isomerism, diastereomerism. These were the areas where questions were raised. Is that clear? But now slowly they have shifted away from this area. Now look at this part. They are focusing mostly on the mucopolysaccharides. Now remember, the mucopolysaccharides can also be called as glycosaminoglycans. They are also referred to as heteropolysaccharides. Now, what are the tricky questions raised from this topic here? They can bring in a concept of dextrin versus dextran also. Remember, dextrin, RIN, is a breakdown product of a homopolysaccharide called as starch, while dextran is a type of heteropolysaccharide. And this dextran can be used as a plasma expander whenever the blood pressure falls because of hypovolemic shock. Because of low volume, if they go for a hypovolemic shock, it can be used. Now, why mucopolysaccharide? Because they are present in the mucoid parts of your body and they are capable of attracting water, especially in the disc spaces. And why are they called as glycosaminoglycans? The glyco part because of a hexose or a sugar that is present, and amino means that sugar can be aminated. What is a glycan, anybody? Can anybody tell me what is a glycan? Yes. What is glycan, anybody? Now let me tell the differences here. There are words called as glycan. There is something called as glucan. There is something called as furan. There is something called as pyran. There is something called as fructan. All these are to be learned properly. Just listen carefully. Glycan means acid form of a sugar. Acid form of a sugar. For example, if I take glucose, 1, 2, 3, 4, 5, 6 carbons. The first carbon is the one who has CHO. If the first carbon CHO is becoming COOH, then there is the aldehyde carbon becoming acid. That is called as aldonic acid. If it is glucose, it's gluconic acid. Galactose, galactonic acid. Mannose, mannonic acid. Now, if the sixth carbon, that is CH2OH, is becoming COOH, then that is called as uronic acid. If both of them are becoming acids, then that is called as saccharic acid. So either it is the uronic acid or the aldonic acid or the saccharic acid, you will call that as glycan. In glycosaminoglycans, first you will be having a sugar, for example glucose, and that glucose can become N-acetylated. So N-acetylated means when you have an amino group attached to the sugar residue, to the amino group, if I attach a COOH with a CH3, this is called as acetyl. N-acetylated sugar. So glucose with N-acetylation along with that of a glycan, which is glucuronic acid or a galacturonic acid or mandronic acid, that is the completion of glycosaminoglycan. So glycan means acid form of sugar. Glucan means continuous chains of aldo sugar. For example, glucose, 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 glucose. A homopolysaccharide of glucose like either glycogen or starch. Both of them are glucans. What is furan, pyran? These are the forms of a sugar. What is fructan? Fructan means a keto sugar on repeat. For example, inulin. Inulin keto sugar is fructose, 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 fructose. That repeat is called as fructan. Glucose, 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 aldose repeat is called as glucan. Let me show you what is a furan and a pyran. Imagine if this is a 6-carbon compound. 6-carbon compound. If I draw a structure like this, I'm sorry, I'll use the reference slide. Now, in this particular area, I have 1, 2, 3, 4, 5, 6 edges. One edge is filled with oxygen. This is C1, C2, C3, C4, C5. While if I have a CH2OH here, then the 6th carbon is here. So in a 6-edged area, one edge is filled with oxygen and the remaining you have 5 carbons inside the ring, 1 carbon outside the ring. That is called as pyran. Generally, glucose 99% to 90% is found as pyran. But what is furan? Now look at this part. If at all I try to draw a structure like this, you have a CH2OH on this side also, a CH2OH on this side also. Now here, this is C1, C2, C3, C4, C5. This is C6. Here, it is a 5-edged ring. One edge is occupied by oxygen. Now 4 carbons are inside the ring. 2 carbons are outside the ring. This is called as furan. Fructose 99% is found as a furan. Did you understand the meaning of all these words? Thank you, Meena Krishnan. I hope it is helpful for you. Did you understand the meaning of all these words? Glycan is acid form of sugar. Glucan is repeats of aldo sugar. Fructan is repeats of keto sugar. Furan and pyrans are Haworth projection. Furan means only 4 carbons inside the ring. Pyran means 5 carbons inside the ring. And generally, glucose or aldohexoses are present as pyrans, while ketohexoses are found as furans. Is that clear? And this is one of the areas where the carbohydrate chemistry can come into play. Please read about all the mucopolysaccharides, okay, high yield areas. Read about all mucopolysaccharides and also read about mucopolysaccharidosis. They can ask you questions like this. That is, how do you know it's a mucopolysaccharidosis? The faces are coarse facial features. Please mark this line. Whenever you see coarse facial features, it actually will point towards mucopolysaccharidosis of any types. And mucopolysaccharides are not broken down because the lysosome is not properly present. So lysosomal storage disease is also the name for it. Likewise, lysosomes are important for breaking down lipids also. So sphingolipidosis can also come under lysosomal storage disorders. So read everything about sphingolipidosis, mucopolysaccharidosis, every single disease. Now, for example, we speak about Hunter's disease versus Hurler's disease. Hunter is somebody who has to hunt. His vision should be good. So he will not be having corneal clouding. Corneal clouding is absent in Hunter while it is present in other diseases. Moratio-Lamei. All these are different types of mucopolysaccharidosis. They'll ask you questions. Read about 5 clinical features of each of the disease and then try to solve any kind of clinical picture from that. Your answers are settled. Also, there is a glycogen storage disease question paper starting from von Gerke's disease. The most commonly asked disease would be von Gerke's disease. If you work on it, definitely you will be able to score some marks. And coming to the genetics part. In genetics, mostly there is questions from that of DNA repair mechanisms. Do you know what DNA repair mechanism was asked in the previous exam? The last NEET 2021 exam. They are asked about a mismatch repair, and that was, yes, do you know which one was that? hereditary non-polyposis colon cancer. You can also learn about cocaine syndrome, Bloom syndrome, ataxia telangiectasia, telangiectasia kind of diseases. Read about them. There is a very good possibility you will get one question. Then you read about DNA replication, transcription, translation. You can have questions from post-translational modifications. When they say PTM, don't be confused. It can be both post-translational or it can be post-transcriptional modification. Work on them both. Okay. For example, in case of post-transcriptional modification, a HNRNA is getting converted into an mRNA where you will be having the 5' end getting 7-methylguanosine capping, 3' end going for a polyadenylyl tailing. In case of splicing, exons have been attached together, introns have been removed. All these things, they will raise you questions. And most importantly, read about the techniques. Okay, read about the techniques. Techniques can definitely fetch you MCQs. So read about PCR techniques. PCR can also be RT-PCR. Remember, whenever it comes to an RNA virus, RT-PCR will be helpful. It can be reverse transcriptase PCR. There is one more type of PCR called as real-time PCR. Try to understand the differences. Then what are nucleic acid amplification tests? These are important microbiology for identifying a bacteria. Nucleic acid amplification test, it can be PCR, which is polymerase chain reaction. It can be LCR, which is ligase chain reaction. It can be TMA, which is transcription mediated amplification. Again, you can have questions from that of VNT. You can have questions from that of SNRPs. You can have questions from that of fluorescence microscopy, and you can have questions from that of fluorometry. You can have questions from that of RFLP, restriction fragment length polymorphism. You can have questions from that of MALDI-TOF, that is matrix assisted resorption and laser desorption and ionization, time of flight. Okay, this can be a very important question in the current area, MALDI-TOF. Then you can have questions from mass spectrometer, X-ray crystallography, NMR spectroscopy, that is nuclear magnetic resonance spectroscopy. If you can get any questions from this area, you should be able to answer them. Also, when it comes to lipoprotein metabolism, what are the other topics raised? In the previous exam, lipoprotein metabolism questions were raised. Fredrickson's classification of dyslipidemias you have to learn very carefully. Dyslipidemias like type 1, type 2A, B, type 3, type 4, type 5, where type 2A is very important for familial hypercholesterolemia, while 3 and 4 can be mixed, while type 1 can be hyperchylomicronemia. They can ask you questions from that. HDL cycle is important, where they can ask you questions about HDL abnormal metabolism. Then you can also have questions from that of metabolism in case of carbohydrates, amino acids and lipids. Last year question was about glycogen metabolism. The question was about the patient actually had his last meal by 8 p.m. At 7 a.m. what can be the source of fuel? Remember, if it is between 16 hours to 48 hours, glycogen metabolism will stop, gluconeogenesis will start. It begins to supply the glucose. If the fasting is for within less than 16 hours, then glycogenolysis can be helpful. But glycogenolysis will slowly decrease from that of the 3 hours of fasting till that of 16 hours of fasting. So between the 12 hours to 18 hours, the hinge area, both glycogenolysis and gluconeogenesis can be helpful. That question was asked. In that question, the answer was liver glycogenolysis, but the also other possibility was gluconeogenesis. So remember these things also. These are the most common areas for questions to be raised. Okay, so these are the high yield areas which can definitely fetch you questions in your exams. Is there anything that did not actually make you feel comfortable? Please tell me. Is there anything you want me to? Yes, Lynch syndrome was also present. Yes. Yes, any questions that you have? See, let me repeat once again. On 28th of April, I'll be doing a marathon 3-hour session with 100 MCQs, massive number of MCQs, which can include PYQs, previous year questions, and image-based questions, where we'll be discussing biochemistry in and out in a very short format. Yes, in that short format. After going through that session, you will be having some confidence. That is, if I teach you 100 MCQs, behind every single MCQ, I'll give you the answer, and I'll give you what is not the right answer. I'll tell you why these are not the right answer. Then I'll tell you 5 to 10 points about that particular question. So it includes, for every one MCQ, it may take approximately 5 minutes to 10 minutes. In that, we will learn about at least 10 facts and 2 concepts, and multiply that by 100. So you can have approximately 1000 facts and 200 concepts taught to you in just one particular session. And if you go to the exam, and even if you get 7 to 8 questions related to that, your answers and your marks will be jumping. Yes, we'll teach neutralization repair also. Yes, that particular topic is also important. We'll learn that also in the marathon session. So this is to tell you that these marathon sessions are important. So for those people who would like to ask me more questions, you can always reach out to me either by putting a comment box here or reaching out on the groups. Okay, I'm sorry this wouldn't have been shown. Yes, I have discussed as many questions as possible, and I have told you as many topics as possible. If you have any other questions, you can ask me about the topics. Yes, definitely we'll do all these things when we come for the Yes, if it is 12 hours to 16 hours, the glycogenolysis will start declining, while gluconeogenesis will slowly start. So definitely nobody will be able to exactly say who is actually converting the glucose, because both can contribute. That was the most important controversial part, but the controversy can be solved by reading Harper. In Harper, if you learn about 12 hours to 16 hours, you will realize that glycogenolysis is slowly declining and gluconeogenesis is starting. In that question, for that exam in 2021, the right answer is liver glycogenolysis, as according to most of the people. But if you want to have a opposing argument, in that argument, gluconeogenesis also can be helpful. That is what I wanted the students to learn about. Is that okay? So these are the different topics I told you. I'll repeat once again. Look at this part. The first and foremost is read through all the important vitamins. When you want to begin biochemistry, read vitamins, and every vitamin is worth its weight in gold. And read about all the biochemical reactions where the vitamins are involved. That is including A, C, D, N, K, and B complex and C. Then you go for the metabolic pathways that are related to the vitamins. From there, you go for the protein structure, where you don't have to read in and out of protein structure. Just learn about what are the important roles of different structures, especially supersecondary structures and tertiary structures. And remember, hemoglobin is a quaternary structure, myoglobin is a tertiary structure, because of which the allosteric regulation and positive allosteric modification of hemoglobin binding is actually present in hemoglobin, but not in case of myoglobin. In hemoglobin, you can have a sigmoid curve of oxygen dissociation curve, but in case of myoglobin, you will be having a hyperbola. All these things are based on structural differences, and Rosman fold, all these things, learn about them. Then read about the classes of enzymes and the enzyme activity, Michaelis-Menten equation, and inhibition of the enzymes by competitive, non-competitive, uncompetitive, and suicidal. Then learn about the different vitamins, different amount of amino acid metabolic pathways and the diseases. Then focus on the mucopolysaccharides and glycosaminoglycans, mucopolysaccharidosis as a disease. Then read about the glycogen storage disease and other lysosomal storage diseases like lipid metabolic storage disorders. Then about different structures of mucopolysaccharides. Then genetics, DNA repair mechanisms, all the different syndromes, post-transcriptional, post-translation modification, etc. And about the techniques and lipoprotein metabolism, dyslipidemias, and glycogen metabolism. All these things have been asked in the last 3 to 4 years. If you perform very well in these 3 topics, you'll be able to answer well. Okay, I wish the best for you, all the very best. Good night. I'll see you on 28th of April, where I'll be doing the 100 MCQs marathon. Good night.